Hello friends, I'm Dr. Vijay Agarwal and today we are going to have an interactive session on smoking. Smoking is a very big problem in our society and all of us know smoking is injurious to health. As per WHO's report, every year more than 8 million people die of smoking, some or the other disease caused by smoking. So we need to discuss this subject little more in detail. For this, we have called an expert, Dr. Vivek Wilde. He is a senior consultant physician at Apollo Health and Lifestyle, and he is an authority on lifestyle disorders, especially smoking. He has done a lot of research on this. So let's understand from him uh, how injurious smoking is and what can we do to avoid all the side effects caused by smoking. So welcome, Dr. Wilde.
Thank you, ma'am. Thank you so much.
So it is no brainer. Everybody knows that smoking is injurious to health.
Correct.
Now today we want to know how bad it is, how does it affect our body. So we want to know from medical point of view.
Right.
So what exactly happens when you smoke?
Sure. So we all know one thing, that is smoking is injurious to health and it can cause cancer. We all know that. But then when a person smokes, the smoke enters through the lungs and from the lungs it passes on to the bloodstream, and from the bloodstream it passes on to various cells and organs in the body. And so it starts damaging every organ and every cell in the body, eventually leading to disorders, diseases, and eventually cancers. So smoking is very injurious to health and it can cause damage to every part of the body, every cell in the body. And the earlier a person stops smoking, the better it is for his quality of life, and it can also improve the longevity of his life if he can stop smoking. So smoking can affect each and every part of the body.
I just want to know one thing. Is there any permissible limit for smoking? I can smoke 2 cigarettes, but that is okay. But if I smoke five, it is injurious. Is there any limit like this?
No, when it comes to smoking, definitely there is nothing like a limit, because every time one puff that they are taking in more than 6,000 plus toxins into their body, which can affect their DNA, which can affect their organs, which can affect their cells. So every time they are smoking, there is a cumulative effect or an add-on to the damage that is happening in the body, and eventually they land up into problems. So when it comes to smoking, one should not smoke. There is no permissible limit, and they should stop smoking if somebody is smoking for a longer period of time.
So suppose I am smoking for say 10 years now.
Right.
So now today I realize that I should quit smoking. So if I stop smoking today, so will the damage which already has occurred in my body, will it be reversible or it will stop there? It will not damage further.
So it totally depends. It's completely subjective. Depends on how long the person has been smoking. If there is an irreversible damage which has already happened in the body, then he might not see a change. But at least by stopping smoking immediately, he is putting a stop to the progression of the damage that is happening in the body. He is also giving his chance to his body to rejuvenate itself and get back to normal. He can improve his quality of life. And if there is no damage that has happened, there's a pretty good chance that once he quits smoking, the whatever minimal damage that has happened in the body will recover, and his quality of life will improve and the longevity will improve. So it completely depends. But then saying that irrespective of how long the person has been smoking, I would still say that one has to stop it immediately and try to do the best, talking to their physician and talking to the people who can help them get rid of the problems out of smoking, and also improve their quality of life.
Okay. So my next question, I think everybody wants to know, every smoker wants to know. Everybody knows smoking is injurious to health. And they just got into this habit because of peer pressure, friends or whatever.
True.
Now they want to quit smoking, but they don't know what to do for it.
Yeah.
So if suppose one person decides to quit smoking, how should the person go about it?
So there are various therapies for quitting smoking. It all starts from nicotine replacement therapies, such as nicotine patches, nicotine gums. You also have medications such as bupropion. You have Verniclin. So your physician will be able to help you out, give you an understanding about what medications are available and how to quit that. You also have behavior therapies which you can follow, so that all these mechanisms can definitely help a person quit smoking and also get rid of the withdrawal symptoms and also improve the quality of life, the longevity of life.
Okay, thank you so much. So with this, I think all our viewers would have understood by now. If you are not smoking, it's very good. If you are smoking, please decide to quit smoking, take your physician's help and take other remedies available. So thank you very much.
Thank you.